This vaccine is used to prevent serious, sometimes fatal, infections caused by a certain bacteria, Bacillus anthracis, in people who may be exposed to the bacteria, such as military personnel and lab workers who handle the bacteria Bacillus anthracis. It may also be used along with antibiotics to prevent getting the infection after being exposed to the bacteria. This vaccine contains parts from Bacillus anthracis and works by causing the body to produce its own protection, antibodies, against the bacteria. It is important to follow the recommended dosage and timing for this vaccine to ensure its effectiveness. Before receiving the anthrax vaccine Adsorbed Adjuvant 0.5 ml per dose intramuscular suspension, make sure to read all the vaccine information provided by your healthcare professional. If you have any questions, don't hesitate to ask them. The vaccine is administered by injection from a healthcare professional. Depending on the brand and your medical condition, it may be given either under the skin or into a muscle. To ensure the best protection, the vaccine is usually given in a series of doses. It is important to closely follow the vaccination schedule provided by your healthcare professional and keep all scheduled medical appointments. It may be helpful to mark a calendar as a reminder. If you experience pain, redness, or swelling at the injection site, limited arm movement, muscle ache, headache, or tiredness, it's important to tell your healthcare professional right away. Some people may also have symptoms like fainting, dizziness, vision changes, or ringing in the ears after getting the vaccine. If you experience any of these symptoms, seek medical help immediately. Remember, this vaccine has been prescribed to you because the benefit to your health is greater than the risk of side effects. Serious allergic reactions to this drug are rare, but seek medical help if you notice symptoms like rash, itching/swelling, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects, so contact your healthcare professional if you notice any other effects. If you have concerns about side effects, you can report them to the Vaccine Adverse Event Reporting System in the US at 1-800-822-7967, or in Canada, to the Vaccine Safety Section at Public Health Agency of Canada at 1-866-844-0018. Before getting the anthrax vaccine Adsorbed Adjuvant 0.5 ml per dose intramuscular suspension, make sure to inform your healthcare provider if you are allergic to it, latex, or any other allergies. This vaccine may contain inactive ingredients that can cause allergic reactions or other issues, so it's important to discuss this with your healthcare provider. Also, let your healthcare provider know about your medical history, especially if you currently have a fever or illness, or if you have immune system disorders such as HIV infection, certain cancers like leukemia or lymphoma, or if you are undergoing cancer treatment or radiation therapy. This vaccine is not recommended for use during pregnancy as it may harm an unborn baby, so consult your healthcare provider for more information. Additionally, it is unclear if this vaccine passes into breast milk, so it's important to consult your healthcare provider before breastfeeding. As for the daily dosage, the recommended amount is 0.5 ml per dose, administered as an intramuscular suspension. The optimal timing for receiving this vaccine should be discussed with your healthcare provider based on your individual health needs. When taking anthrax vaccine Adsorbed Adjuvant 0.5 ml per dose intramuscular suspension, it's important to be aware of potential interactions with other medications. Drugs that weaken the immune system, such as cyclosporin, tacrolimus, cancer chemotherapy, and corticosteroids like prednisone, may interact with this vaccine. It's crucial to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your healthcare professional. Do not start, stop, or change the dosage of any medicines without your doctor's approval. This will help ensure the vaccine works effectively and reduces the risk of serious side effects. Always consult with your doctor before making any changes to your medication regimen. Anthrax vaccine Adsorbed Adjuvant 0.5 ml per dose intramuscular suspension is used to prevent anthrax disease in people who may be exposed to the bacteria through their job or travel to certain areas. This vaccine is also used to prevent the disease in people who have been exposed to anthrax. It is given by injection into a muscle by a healthcare professional. The usual schedule is 5 doses at 0, 1, 6, 12, and 18 months, followed by booster doses at 12-month intervals for people at continued risk. This vaccine works by causing your body to produce its own protection, antibodies, against the bacteria that cause anthrax. The optimal timing to take this vaccine is as recommended by your healthcare professional. It is important to receive all recommended doses of this vaccine to get the best protection. It is also important to receive the booster doses to keep the protection up to date. This vaccine is a vital tool in preventing anthrax disease in those at risk of exposure. Like all vaccines, the anthrax vaccine Adsorbed Adjuvant 0.5 ml per dose intramuscular suspension may not provide complete protection to everyone who gets it. It is important to understand the benefits and potential concerns of this vaccine before deciding on its use. The recommended dosage for this vaccine is 0.5 ml per dose, administered as an intramuscular injection. It is important to follow the recommended schedule for vaccination to ensure the best possible protection. Always consult with your healthcare provider for the best timing and dosage for this vaccine. Make sure to receive each vaccination as scheduled. It's important to ask your healthcare provider about the timing for each dose and mark it on your calendar to help you remember. When storing the anthrax vaccine Adsorbed Adjuvant 0.5 ml per dose intramuscular suspension, it's important to keep it in the refrigerator, but be sure not to freeze it. As with all medications, it's crucial to keep it out of reach of children and pets. When it comes to disposing of the product, it's essential not to flush it down the toilet or pour it into a drain unless specifically instructed. Instead, it should be properly discarded when it is expired or no longer needed. If you have any questions about how to dispose of the vaccine, it's best to consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.